Leech therapy, also known as hirudo therapy, is an ancient practice that involves the use of leeches to treat various medical conditions. This therapeutic technique has been used for thousands of years, dating back to ancient Egypt, and is recognized for its ability to promote blood circulation and reduce swelling. The saliva of leeches contains biologically active compounds, including hirudin, which help to prevent blood clotting and reduce inflammation. Leech therapy is particularly popular in modern times for its application in plastic and reconstructive surgeries, aiding in the restoration of blood flow to damaged tissues. Despite its historical roots, leech therapy is gaining renewed interest as a natural and effective treatment for various conditions. How does leech therapy work? Medicinal leeches have 3 jaws with tiny rows of teeth. They pierce a person's skin with their teeth and insert anticoagulants through their saliva. The leeches are then allowed to extract blood for up to 45 minutes at a time from the person undergoing treatment. This equates to a relatively small amount of blood, up to 15 milliliters per leech. There are several situations in which leech therapy may be used. People who may benefit include those who risk limb amputation due to the side effects of diabetes, those who have been diagnosed with heart disease, and those who are undergoing cosmetic surgery in which they risk the loss of some of their soft tissue. The therapy has also been recommended to treat blood clots and varicose veins. People with anemia, blood clotting conditions, or compromised arteries are not candidates for leech therapy. Children under the age of 18 years old and people who are pregnant are also usually advised to avoid it. Medical applications for leech therapy. During a session, live leeches attach themselves to the target area and draw blood. They release the proteins and peptides that thin blood and prevent clotting. This improves circulation and prevents tissue death. The leeches leave behind small, Y-shaped wounds that usually heal without leaving a scar. Leeches may be effective at increasing blood circulation and breaking up blood clots, which is why they may be helpful in treating circulatory disorders and cardiovascular disease. Can leeches help with diabetes? The progression of diabetes can cause numerous problems. These problems can lead to vessel diseases that limit or prevent blood from reaching the legs and feet. When blood flow becomes severely restricted, the affected tissue can die. This is the leading cause of amputation among people with diabetes. Losing a digit or limb due to complications from diabetes is a major concern for millions of people worldwide. The most effective way to stop this process is to increase circulation to the affected tissues without the risk of blood clots. Research has shown that leech therapy can play a role. An older case study showed how traditional Unani medicine, which includes leech therapy, was able to help save the foot of a 60-year-old woman with diabetes. Synthetic forms of leech saliva now exist, but researchers have discovered that using as few as 4 leeches in one session can help reduce the risk of amputation. Is leech therapy safe? Leech therapy is typically a very safe procedure. However, there are potential complications such as infection around the wound site, prolonged bleeding, and an allergic reaction to leech saliva. How painful is leech therapy? Leeches produce an anesthetic during attachment, so leech therapy is usually painless. If a person experiences pain during leech therapy, they should let their healthcare professional know. Leech therapy, with its proven ability to enhance circulation and reduce inflammation, remains a valuable tool in modern medicine. While it may seem unconventional, its benefits, particularly in surgical recovery, cannot be overlooked. As scientific research continues to validate its efficacy, leech therapy is likely to maintain its place as a unique and effective complementary treatment.